The Art and Science of Nursing. Here is one story of a little girl named Danielle and her journey to becoming a professional nurse. Danielle grew up in a single-parent household, and she was the oldest of three, so nurturing and caring came easy to her. Unfortunately, Danielle had health issues, nothing serious. She was always a frequent flyer in the emergency room for bronchitis, fevers, ear infections, broken leg. Her family did not have insurance. However, while she was there in the ER, Danielle watched as other nurses take care of patients and how gentle and caring they were. She became inspired and saw herself in those nurses. Danielle grew up and graduated from high school. She left for college, but after a year she returned home as her family needed her and the cost of school was too great. Then once again, some years later, Danielle found herself in the ER. She was in extreme pain, been vomiting, nauseated. She was admitted and diagnosed with a chronic disease. But while there, she had an epiphany. She said to herself, "You can become a nurse and help others learn and manage their chronic diseases." Danielle enrolled herself in a local community college, who happened to have a reputation of having one of the toughest nursing programs in the state. 80% of students who graduated from this nursing program passed their state boards on the first try. Danielle was accepted into the program and she was ecstatic. She began classes and started to realize how little she knew about nursing. Then when clinical started, it was there that she learned the science of nursing. She learned how to take blood pressure, code simulations, nursing care plans. But it was hard as she tried to deal with families, their patients, administer medications, reporting to doctors, being scrutinized by professors and ignored by the nurses on the floor. To help with her confidence, she got a part-time job as a nursing assistant. She worked per diem on the weekends on a orthopedic trauma care floor. This was a great experience for her. That helped her gain her confidence and skills which she needed and was very useful in clinicals. Danielle graduated from nursing school. She was the first in her family to earn a degree. She surprised herself when she passed the boards on her first try. Then she transitioned to RN on the same floor in which she was a nursing assistant. This transition was easy for her, more difficult for her coworkers. However, Danielle's confidence and professionalism gained the respect of others. Danielle continues to grow in the profession of nursing. She learned how to effectively communicate with other healthcare professionals. She learned the art and science of nursing. Danielle learned how to effectively communicate with physicians and not be intimidated by them, and learned how to be a true patient's advocate. Learned how to paint the picture over the phone, explaining patient symptoms, trying to figure out what's wrong with the patient. Learned delegating to LPNs and nursing assistants. Danielle is now an oncology certified nurse in the role of chemotherapy coordinator. She spends a lot of time with her patients and their families, educating them and supporting them. Danielle continues to grow and stay current on evidence-based practice to help her patients and families make informed decisions about their treatments and goals. She plans to continue her education and become a certified registered nurse anesthetist. Thank you for taking the time to listen to my creative professional nurse identity storybook. Some pictures used in this story are fictional characters and not a true depiction of Danielle or her patients. Thank you.